My name is Darare Gonche Salesa, and I work for an organization by the name Indigenous Resource Management Organization. In short, it is Iremo, and Iremo works and we operate in Marsabit County. It is one of the largest county in Kenya. Because of the vastness of Marsabit County and because of the challenges which has been there for a long time, Marsabit being one of the hotspot areas for conflict with persistent drought. Now here with us is COVID-19, which is currently one of the biggest disaster. So in this relation, we as an organization, in partnership with Diakone Kenya, they supported us to carry on a COVID-19 intervention, which targets around 4 wards in Marsabit County. These are Loglogo ward, targeting Ilbaruk and Lokileleng location. We are also targeting Karare ward, where we have targeted Parkishon location. We are also targeting Turbi ward, where our target area is Shur location. And the last ward is Maikona ward, where we have targeted Puri Hills and Forole location. So these are our areas of operation in terms of COVID-19. COVID-19 is quite pandemic in this area because our people are pastoralists. They move from one place to another in search of pasture, in search of water. And there is that kind of interaction where sometimes it may not be possible, to ask people to keep distance. But all in all, we have been giving them awareness training, and awareness training was done for our park volunteers who are currently, acting as health promoters, where they have been trained. They have been moving from one village to another, sensitizing communities on COVID-19. For Iremo, we believe that community have to take the lead in all the crises. And we say that instead of us hiring vehicles, moving around from one place to another, we said we better engage our park volunteers who are the health promoters in terms of training, so that as they do their daily work, while they move from one village to another, which is much easier, and with the motivation of small money, we said they need to move from one village to another, a place where even the vehicles cannot reach, a place where even motorbike cannot move. But human being can walk from one village to another doing that kind of sensitization. And we feel that this is the best approach, where communities are empowered, especially the young people who can move from one place to another. The people whom we have reached so far in terms of this intervention are 4,840 households. If we translate this into the size of population, because based on 2019 census, one household has an average of 5.8 people. So after translating the 4,840 household, it's like we have already reached 28,069 people within that particular area. That is the total number. We also said that as much as we want our young people, that is the park volunteers, to move from one place to another, reaching the community, we also need to do a radio talk show in terms of, where we have developed a content both in Borana language and Krendile language, and it has been aired on our local radio station, which is majorly listened to by the pastoralist community, especially after they are back from livestock herding in the evening. And this, for sure, it must have reached over, I don't know, the number could be even 100,000, because when you use mass media, you will reach so many people at a go. Of course, all that you do, you will not miss some hiccups. That is in terms of challenges and gaps. It is true that we have targeted the 4 wards, but although of course there are other actors who are doing the same, but majorly, reaching the rural communities may be quite difficult. And one of the challenges which we have so far seen is that many of, especially the children, do not have, face masks. In some areas, there are challenges of water. You cannot maybe, as much as they would wish to wash their hands, if you even don't have water to drink, so how do you expect, communities to wash their hands? This could be a problem. Of course, although of course, due to this pandemic, we have been advising them that as much as possible, even if they have got little water, they need to wash their hands. Marsabit County is also quite vast, and because of this vastness, it may be also difficult even for us as an organization. It may be difficult to move from one place to another because you need a vehicle, even in terms of monitoring, even in terms of going to the grassroots to train the park volunteers. It is not quite easy. Iremo majorly focuses on women, and one of our main target beneficiaries are the women. And we have been providing them with little grants so that they may start an alternative livelihood. It seems most of them are dropping out of business. Why are they dropping out of business? It is because COVID-19 has really affected, movement of people. Many of the husbands may not be working. So all what they do is they go back home with what they have, which means this one will affect, the stock will reduce, that is for sure. Secondly, in terms of, loan repayment, because this is a merry-go-round, they have been paying these funds to one another, and this may also delay, and the repayment rate may be even low. And thirdly is in terms of poverty. Many people are quite poor, and they may not be able to, because they are told to stay home, they may not be able to realize, having food, the 3 times food, daily intake may not be as usual as before. Where we have been working, of course, there are other actors, and other actors means provision of personal protection hygiene, provision of sanitation that they have been doing. But I don't think whether this is enough, because as much as we may want funding for this particular intervention, I'm sure all other areas, all other countries worldwide has been affected. There could be some challenges of funding.